Hello, my name's Tom Tasker. I'm a GP in Eccles and I'm also Clinical Chair of Salford CCG. Every GP practice is part of the CCG. We work together and in partnership with Salford City Council and other public and voluntary sector organisations to plan the best way to spend the health and care budget for Salford. Our vision is to have high quality services so that people in Salford can live longer, healthier and happier lives. Of course, 2021 was the year in which the world had to deal with COVID-19. Our annual report is a story of how Salford CCG responded and the progress that we made towards achieving our vision in the midst of a global pandemic. I would also personally like to thank all the health and care staff who worked so hard throughout the pandemic and for the public and population of Salford who supported us as we tried to do our very best.
The last 12 months have transformed the world in ways we could never have imagined and put us all through our biggest test. We have all been impacted by COVID-19 one way or another. Within a national control and command environment, we have needed to work together as a city to suppress the virus, reduce the rise in infections and roll out the biggest vaccination programme in the history of the NHS. Together with partners, we have been called on to provide some services for the very first time and at a pace and scale not seen before. We invested more than £1 million in primary care services, commissioning Salford Primary Care Together to set up COVID-19 assessment centres. Our GP practices have faced unprecedented demand and we've worked with our 5 primary care networks to ensure they have the support needed to stay open for their patients. In December 2020, the Salford NHS Vaccination Service launched. Salford Primary Care Together run the service on behalf of primary care and opened 3 large-scale centres to offer the vaccine as quickly as they could to eligible cohorts. Working with our GP practices, we've seen several pop-up clinics delivered across the city, ensuring all patients had the option to be vaccinated locally. A housebound vaccination team delivered the vaccine to our most vulnerable patients, and the Salford Primary Care Together Inclusion Service work with homeless residents to ensure they're not forgotten. We work with the Salford Community Learning Disabilities team to encourage more people with learning disabilities to have the vaccine by offering them a home visit from a specialist nurse. The NHS did not become a COVID-only service. We have worked hard to keep our critical health and care services running, alongside the COVID-19 response. Our services have followed infection control requirements so they could be delivered effectively, efficiently and safely. Wherever possible, digital technology is used, with face-to-face consultations, diagnostics and treatments still available when needed. All our GP practices moved to virtual telephone triage of all patients, only bringing patients into practice for face-to-face appointments when needed, so they could stay open throughout the pandemic. Alongside fighting the actual virus, we've also had to deal with the unforeseen consequences of COVID-19. Long stretches of isolation have impacted many people's mental well-being. Some routine, non-urgent care had to be paused. Fear of being a burden on an overstretched NHS delayed many people, both with COVID-19 and without, from seeking the help and advice they needed. Clear recovery plans are in place and those patients waiting longer are being reviewed to minimise harm caused. Referrals and those on waiting lists for treatments are being prioritised according to need, with cancer and other urgent treatment prioritised. Throughout our time as a CCG, the voice of Salford people has been at the heart of everything we do, never more so than throughout the last 12 months. We continue to be grateful to the support and understanding shown to our health and care staff by our residents as we adapted services, and more than 1,000 who shared their insight into how we build back our health and care system through our big reset conversation, shaping our plans for the future. We have a new NHS, albeit we had not imagined how this would come about. We are at an important pivot point. Given current demand from COVID-19 has reduced, we are proceeding full speed with the recovery. COVID-19 will not be going away completely, and we recognise that if we need to manage COVID-19 again, we are all well practised and in a good position to do so. If you would like to learn more, Our full annual report and accounts are available on our website www.salfordccg.nhs.uk.